Thank you so much. I'm delighted to be here. I love coming up to Ark House. The talks usually go on for a few hours, so I'm going to try and keep it under wraps today. So you've heard enough about me, but I just wanted to say from the outset that I didn't intend to start research into this topic of menopause. It emerged out of research that Katie Johnston, who's a research dietitian in CUH, which a lot of you may have come in contact with her through the LISA study. It's a topic that came out of that trial that's going on in CUH. And it was, I suppose, when I was talking to Katie about this topic of menopause was the overwhelming topic that was coming out of these conversations with the women because of their debilitating symptoms. And there's a lot around nutrition and menopause. And for today's talk, I can't go through everything, and I don't think it'd be worthwhile to go through everything diet-related with you this morning. I think what I'm going to do is focus on the main points that I think that you can work on today, and the main points that you can incorporate into your lifestyle, so you don't get overwhelmed with loads of different dietary messages. My main area of research, and that I love, is all around muscle. So my talk's going to complement what Brenda's talked about very nicely. And I also will concentrate on bone health, and then I'm going to actually take you through supplements, because that's the latest bit of research that we're working on at the moment. So I'm going to take you through dietary and herbal supplements on the market, and we're going to go through that because I think you'll find that probably the most interesting part of the talk. The last time I was here in Ark House was during the summer, and we asked at the very beginning of the talk to the ladies, what did you want me to talk about? And these were a few of the things that they asked, and I'm going to try and cover some of these now today, and hopefully we'll get through a good few of them. The other reason why I like to talk about menopause and nutrition after cancer is it's one topic that isn't addressed when you're going through your cancer treatment. From a nutrition point of view, the whole side of menopause, I don't think, in my opinion, and you can correct me if I'm wrong, it's usually not addressed. We don't have enough dietitians in the country, let alone in cancer, working in cancer, to see everyone who's going through cancer. So we know that there's a massive gap there, an evidence gap. I'm going to copy what Brenda's said already. There's a massive evidence gap there as well for the evidence that we can give to patients. And sorry, some of my slide might be a bit cut off, but what we do know, how I suppose menopause after breast cancer or female cancers can differ from that of natural menopause. And it's mainly, I suppose, with the treatment-induced, surgically induced menopause, is that the symptoms can be severe, they can be abrupt, they can be debilitating. And especially if the woman is finding no relief from medication, or she's not aware of non-hormonal treatments that she might be able to try for her symptoms, a lot of the time women will steer towards herbal, botanical, vitamin, mineral dietary supplements, because that's the one thing that they can buy by themselves. They don't need to talk to their doctor about it, when ideally they should, and they might be getting advice elsewhere, social media, for example, Dr. Google, and that's where we need to try and, I suppose, provide more evidence to women around this topic. When it comes to cancer, again, there's lots of factors that can impact on your muscle mass, and that's where I'm going to focus first. From your hormone therapy to chemotherapy to the actual tumour itself, they can all affect your muscle mass. And we've done lots of research in this area to show, especially during chemotherapy, during cancer treatment, that your muscle mass is depleted by the chemotherapy. But in addition, the tumour is also affecting your muscle mass. And why do you need to worry about your muscle? Well, muscle, in my area of research, it's the king. It links into every aspect of your symptoms for menopause, but also into your survivorship after cancer. And the more muscle you have and that you can maintain during your treatment, the better your outcomes. There's no evidence gap here now, there's ample evidence to suggest that if you have more muscle or better muscle quality going through chemo, going through radiotherapy, or going through any type of cancer surgery, you will live longer, regardless of your cancer and regardless of the cancer stage, which I think is phenomenal for me to be able to say that to you very, very confidently. So when it comes to muscle, naturally, everyone, regardless, we'll take cancer out of the equation, after the age of 40, Every decade, we start to lose at least 8 to 10% of our muscle mass. So it works out roughly after the age of 40, we start to lose muscle by 1 to 1.4% every year. That's the natural process of aging. If you add cancer into the mix, your muscle mass loss goes up exponentially. So the patients who are going through cancer treatment will continually lose muscle throughout their treatment and thereafter. These are CT scan images of 3 different women who all had the same cancer. All 3 women have the exact same body mass index, or BMI. So their BMI is 26. So from the outset, if I was to see these 3 women standing in front of me, they all look physically similar. However, when you delve in deeper and look into the body composition, so this is an image taken here at the abdomen. What you see in red is I'm going to try and see. I have a pointer. What you see in red here is the muscle mass. SMI stands for skeletal muscle index. It's basically a muscle BMI, if you will. But all you really need to look at here is that this woman here on your far right, her muscle mass is a lot higher than this lady here. However, on the outside, if they're going in for their chemotherapy and they're being seen on the scales and they've all got the same weight, they possibly might be treated in a similar fashion. But this lady over here, this lady over here on the far right, you're going to kill me, this woman, she will have a better tolerance to her treatment. She'll have less chemotherapy toxicity. She will have better survival than this lady here. And we will never know this because we don't assess muscle mass on all our patients. We do it in a research setting, and that's how I'm able to tell you that that lady will do better, because we're able to follow and track these ladies after their treatment. So we don't assess muscle mass routinely. Unless you're on a clinical trial, we will assess your muscle mass. So we're trying to find surrogate markers now in clinical practice for how can we translate this into clinical practice? How can we get our dietitians to try and assess muscle mass without having to get a CT scan? And that is what we're currently working on. So essentially what I wanted, the message is, women who have more muscle mass will have a better chance of survival, and they'll have better outcomes. But this is also linked to your menopausal symptoms as well. So when we talk about maintaining muscle mass, it's only one part of the puzzle. You have to be eating food in addition to working on the muscle. So I'm going to give you some examples of how we can build up our muscle, but I'm also going to give you examples of how we can build up the diet. So I'm all about eating more. You're going to think I'm a bit crazy here, but I'm saying I want you to eat more food. I want women to eat more to build more muscle, especially after cancer and especially for menopausal symptom relief. And when I say eat more food, I'm not going to be saying eat more cake and chocolates. I'm going to say eat more protein, because women don't eat protein. I don't eat enough protein. I'm trying to follow my own advice. I find it hard. I'm going to show you some examples of how to add more protein into your diet. Before we talk about the protein, it's all about staying active. It's all about keep moving. And Brenda's already shown you some lovely slides around activity and how much activity. I'm going to show you my favorite bit of advice when it comes to activity, that yes, we should be doing aerobic and weight-bearing exercise, but in fact there is research to show that it's just around movement. Any type of movement can help with weight loss. And the knock-on effect then is it helps build your muscle mass and it helps with your symptoms. So these are the guidelines in a nice infographic that Brenda will have already gone through. And like being at least 150 minutes of moderate intensity, brisk walking every week, building up strength at least 2 days in the week, doing some sort of strength training 2 days in the week. But where the research is going at the moment, which I love because I'm quite lazy, I'll put my hand up, is NEAT, N-E-A-T. This stands for non-exercise activity thermogenesis. The premise here is around being active, like now, standing rather than sitting down. Ideally, I should have all of you stand up and you'll be actually, participating in building up your non-exercise activity. If you go to the gym and you go to the gym for an hour, that equates to around 4% of your whole daily activity, just going to the gym for an hour. But 63% of your day is spent outside of the gym, for example. Apart, we're taking away time for sleeping here as well. But 63% of your day isn't in the gym. It's at home. It's in work. It's hoovering. It's picking up kids. It's shopping. That all counts. So don't underestimate the importance of even just when you're on a phone call, picking up your phone and going for a walk and doing a lap around the kitchen on your phone instead of sitting down with a cup of tea. Those little tiny changes all help. I've just started one in work where I've picked a bathroom that's ages away from my office. So it makes me go to the toilet, so I have to go the whole way down the corridor and up the stairs, instead of picking the one that's just at the end of my corridor. That tiny little change will help. So any of these little changes work. And that's why I love the concept of just building in more activity. Watch for dancing in the shower. That is probably a health hazard. I probably should have taken that out of the slide. So all movement is good movement. And then we can build up to the 150 minutes per week when we start getting a bit more confident. And even just I was saying to women, if you've got cans of beans at home that you can use for bicep curls on the couch, anything is good. Now I talk about protein because we need protein to build muscles. It's all well and good being active, but we need to be eating right as well. And what I mean by right, it's having more protein. So these are mainly, I'm going to show you some plant-based sources of protein as well, just in case you're not a meat eater or you're a vegetarian. But 20 grams of protein looks like around 3 eggs. It's a 100-gram tin of tuna. It's around 160 grams of cottage cheese, or it's 180 grams of a natural yogurt. Now, why I say 20 to 30 grams, it's quite specific because there's been a lot of research in this area in sports research, whereby they have shown that you need at least 20 to 30 grams of protein to help with muscle synthesis, for help to build your muscles. I've looked at my protein intake over the day, and it's probably quite similar to a lot of your protein intake. We don't eat much at breakfast, eat a bit at lunch, and then we eat the most of our protein in the evening. However, for muscle synthesis, you need to be hitting that target at breakfast, lunch, and dinner. And that is where you'll find a change. You'll find a change with regards to your appetite. You'll feel fuller for longer once you start eating more protein, more regularly throughout the course of the day. So it helps you keep fuller, but it also helps with muscle mass and muscle regeneration. A way to get in more protein, now I'm not sponsored by any brand at all, but these are just examples. These pouches here, these yogurt pouches, they've got 15 grams of protein in them, in one pouch. They can be quite helpful. The only problem when you're looking at yogurts, and it just takes a bit of practice with reading yogurt labels, is trying to pick ones that don't have too much added sugar. So when you're looking at sugar, for example, anything that's flavoured, so you can go and check these now in Aldi today for yourselves. These yogurts here are flavoured yogurts, blackberry, raspberry, peach, mango, whatever it is. They should have less than 9 grams of sugar per 100 grams on the label. And that would mean it's fine. It's in the lower sugar range for yogurts. If you go look at Petit Filous, for example, they hit around 9 to 10 grams. So they're fine. They don't have that much added sugar, because yogurts contain a natural sugar called lactose. And in just natural yogurt, if you go look at the label of a natural yogurt, you'll still see there's at least 4 to 5 grams of sugar per 100 grams. That's coming from naturally occurring sugars, perfectly healthy. Anything over 4 to 5 grams of sugar per 100 grams on a yogurt label is added. So you want to try and make sure that the overall content is just less than 9, and then they're perfect. And that goes the same for your plant-based yogurts as well that have been flavoured. Why do I harp on about body composition? For your musculoskeletal health, for cancer survivorship. It's also been linked to cognitive health. So what Katie's been doing with the LISA study participants is she's measuring hand grip strength. Hand grip strength measures the strength of your muscles. Now, it won't measure the quantity, it won't tell us how much muscle you have, but it tells us how strong your muscles are. That by itself has been shown as an independent marker for survival, hand grip strength. Hand grip strength has been shown to be linked to poor cognitive decline as we get older as well. So the more we maintain our muscles, and we can measure it with the hand grip strength, which is a really quick, easy, simple technique that we can do in the clinic with you, that can be your marker for seeing how well your muscle mass and how well your strength is going. So it might be something worthwhile talking to your physiotherapist or your dietitian, because if they don't have a hand grip monitor, tell them to get one, and tell them that you want to keep measuring your muscle strength, because it's inexpensive and it's a really good little marker. And apart from cognition, it's also linked to lower muscle mass is also linked to higher rates of urinary incontinence. So it's not about just muscle mass in your arms and your legs, it's muscle mass everywhere. So that is why and for your brain. So we need to, that's why I'm always going on about body composition. Now if I quickly transition into bones, what I have here is a chart just showing about, in green, naturally occurring bone loss with age. In blue are people who have gone through cancer. What you'll see here at the highest rate of bone loss on the very end, women who have premature menopause, secondary to chemotherapy, so these are women who have gone through cancer treatment, have the highest rates of bone loss. And rates of bone loss from cancer therapy can be 10 times higher than for women who don't go through cancer. So you've got the added benefit of aging, you've got natural bone loss with aging, but then you've got the added impact of your chemotherapy or your treatment is going to accelerate your bone loss as well. And that's why bone health is so important. Everything you do for your muscle health will help with your bone health as well. So that's why it's really important to work on muscles and bones together. So for bone health, it's all about, and Brendan mentioned this already, these are the three pillars. It's calcium, vitamin D, weight-bearing exercise. 800 to 1200 milligrams of calcium per day. What that looks like, in reality, it's around 3 to 4 portions at least of safe, I'm going to go with dairy foods first. 125 gram pot of yogurt, that would be 1 portion. A 200 ml glass of milk, that's 2 portions. And then if you want like a matchbox size portion of cheese, that's 3 portions. That's 3 portions of dairy. I go maybe closer to the 4 portions to meet the 1200 milligrams of calcium per day. You can get the exact same equivalent calcium in your plant-based sources as long as they say they have added calcium. So you're looking for around 200 milligrams of calcium in every bit of, in a yogurt pot or in a glass of milk. That's what you're looking for. With the vitamin D, and this was a question I might ask Brenda at the end around actually testing vitamin D levels as routine practice. I was at a talk last night and vitamin D levels are not being checked routinely because there's an added cost, I think, for the test itself, but that's something I will ask you after this talk. But the research at the moment is looking at the amounts that we actually need in postmenopausal females, especially after cancer treatment, because you're already in that bracket of having accelerated bone loss, that we need to be on the upper end for vitamin D. When I go through dietary supplements with you, I'm going to stress how important it is that you're not going over and you're not taking upper limits for vitamin D. And then weight-bearing exercise. So get your can of beans, go for your walks. At the Menopause Summit last week, there was a physiotherapist said, look, if you're not into going to the gym and you want to do weight-bearing exercise, there's now these weight vests. Maybe they're not new, but I think she called it rucking. And and you can wear these weight vests for going walking. And that's adding extra weight for your walk, which is fantastic for your bones and for your muscles. A word on plant-based products, they're not all equivalent. And you have to be very careful when you're going for your plant-based products. If you do want plant-based milks, they need to say they've added calcium, vitamin D, and iodine. They're the 3 main things to look for on a plant-based product. Here's an example of a Tesco milk. Has added B vitamins, calcium, iodine, and vitamin D. Here's another soy milk on the other side, but it's organic. If it says organic on the label, it will have no added vitamins or minerals. So this is why organic is not best in this case. You need to have the fortified products. Choose unsweetened, where possible. But ultimately, you're looking for calcium, vitamin D, iodine added into your products. And you can get calcium from non-dairy sources and non-plant-based sources. So you can get calcium in spinach, but you have to eat bags and bags of spinach to get the same or the equivalent calcium you'll get in 200 mils of milk. It's not all equal. And how it's absorbed in the body, it's very different to the way the calcium from cow's milk is absorbed. The closest or the best plant-based alternative to cow's milk would be fortified soya. Oat milks, nut milks, rice milks, they're not as good, especially for building up your bone. And if you do want to go down that route, I would highly advise, if you can, to speak with a dietitian just to ensure you're getting enough calcium. So, diet can help counteract menopause metabolic changes. What I wanted to just focus on now is around heart health, because everything that you do for your bones and for your muscles and for your heart will have a knock-on effect to your weight. It will be beneficial to your weight. So if you focus more on, I'm going to improve my bone health, I'm going to improve my heart health, forget about weight. Focus on what you can do and what you're going to change. The weight will start to come with time. I'd be much happier as your dietitian that you're improving your heart health and your bone health for your survival. And then weight will come. Naturally, if you start to incorporate more of these dietary changes I'm going to show you next, you naturally will be getting healthier without even thinking. So for heart health, we talk about the Mediterranean diet. The Mediterranean diet has been studied in so many different groups of women for so many different conditions. But when it comes to menopause, they've actually started looking at, well, not started, they've been looking at it for years, but they've been looking at the Mediterranean diet for the likes of symptom control. There was a huge study in Australia, over 6,000 women going through natural menopause. By sticking to a Mediterranean diet, they reduced their vasomotor symptoms, their hot flushes. We're all fanning ourselves now. They reduced their symptoms by 20% by sticking to this diet. And what does a Mediterranean diet mean? Because a lot of you will have heard a bit more olive oil. If you want to get down into the nitty-gritty, try and aim for olive oil at least 4 tablespoons per day. So you use that in your dressings, you use that when you're cooking. So you're just replacing out, wherever you had butter, put in a bit more olive oil. I'm not saying you have to get rid of butter completely, but it's a slow transition. Just slowly add in more olive oil. Add in more nuts into your diet. You're looking at least 3 servings per week. I think that's pretty manageable. It's not that much. But it's these quantities that have been proven to actually help and benefit your heart health and your symptom control. More fruits, more vegetables. Every day we should be having fruit and veg. At least 3 fruit, 2 veg, 4 veg, 3 fruit. It doesn't matter. Just have more fruit, more veg. That's the goal. Fish, this is where it gets a bit more specific. We ideally should be having at least 2 to 3 servings of oily fish, ideally, per week. And what I mean by oily fish, it's salmon, mackerel, herring, trout. Those oilier fishes. They are more beneficial to your heart health. If you don't like fish and you don't eat fish, you can take an omega-3 supplement, but you need to be aiming for around 250 to 500 milligrams of omega-3s in your supplement. That basically balances out and it works out roughly similar to having 2 to 3 portions of oily fish. I always try a food first approach where possible. If you can go down the food route first before supplements, please do. And movement, more exercise. I'm going to keep saying that throughout the talk until I'm finished. So yes, I've mentioned about the study, Mediterranean diet can help improve hot flushes or flashes, but it's also been linked to, there's some early studies looking at cognitive function, brain fog, that they're linking now Mediterranean diet with improved symptoms. Eating more plant-based diets can help improve for symptom control. As well as the Mediterranean diet improving symptoms for menopause, the link there with cardiovascular disease is long-standing. There's no evidence gap there. The Mediterranean diet can help reduce your risk of myocardial infarction, like a heart attack, by at least 30%. It can reduce your incidence of stroke by at least 12%. So that's why I love going a food-first approach. It doesn't just treat one symptom. It looks after your whole body. And no one ever wants to hear this because it's not instantaneous. It takes time. It will take 6 to 12 months to see these benefits long term. But you're investing in your health. That's what I always love to say. Just invest in it while you can. And you'll see the benefits. You'll reap the rewards of this. I have to mention about soy because there's this debate around hormone-sensitive cancers. What can I take? Is it safe? So Katie will help me with this argument that the evidence base for soy in cancer, there's a huge debate. A lot of the research is stemming from Asia. I could spend the whole day talking on this. Ultimately here, in the essence of time, soy is okay when it's coming from food. Fine. Because when you start to look at the quantities, and that's where I'm going to break it down for you, the quantities you find in food can be a lot less than what you find in supplements. And when you get soy in foods, the compound that we're actually looking at, it's called phytoestrogens. And this is where people get it's scaremongering because estrogen is in the title. It doesn't mean it's going to put estrogen into your body. The way in which we break these down and metabolize them in the body is very different to a hormone estrogen. So phytoestrogens you'll find naturally occurring in soya foods, tofu, but you also find them throughout other types of food like fruit, vegetables, nuts, flax seeds, linseeds. They're in a lot of the food we eat without even knowing. The concentration, though, is quite low. And it's because the link with phytoestrogens and breast cancer has been shown in Asia that women who follow diets with high soy intakes, like they'd eat a lot more soy and soy-based products over in Asia than we would here, that they had lower incidences of breast cancer. You don't need to be worried about any of that for the moment. Just know that from a food point of view, soy is okay. And it's safe at the moment, as per the guidelines. I would highly recommend you avoid any vitamin, mineral, nutrient supplement that contains soy. And I'm going to show you a few examples in a few more slides. But roughly, to get that benefit for hot flushes, so a lot of people would take phytoestrogens or isoflavones to reduce their hot flushes. It's around 30 to 80 milligrams of phytoestrogens from food. That equates to around 2 to 3 servings per week of soy, of, let me see, I have them here, linseeds. Like, there's only 40 milligrams of phytoestrogens in 100 grams of tofu. To put that into perspective, a lot of the supplements I'm going to show you, some of them have 200 milligrams of soy in them, in a one little tablet. Tofu one has 40 milligrams in a portion. In your normal little soya yogurts, Alpro soya yogurts, there's only around 15 milligrams of phytoestrogens. There's 200 milligrams in a Menopause supplement. Very, very different. And when it's naturally occurring, there's other added benefits from eating these foods. Fiber, vitamins, minerals. It's not just phytoestrogens. So that's why a food-first approach is much safer than going down a supplement route. Which naturally brings me into the final part of my talk, supplements. Over the last 6 to 8 months, we have been working on looking at the market for supplements because this is the most asked question, I think. Well, when I talk to women, they always just want to know about supplements. And it's the area where we have the biggest evidence gap. We don't know anything. I'm going to tell you that. I think it was last year, I was being asked about boric acid. Don't know about boric acid. Never heard of it. Not until I start to look at all these supplements. So we've started to do market research to begin with to find out what's in them. And now we're trying to research all the compounds that's in them. And we have found from our research there's 198 different supplements out there targeted towards menopausal women. They contain over 263 different ingredients. And this is the scary part. None of this is regulated. So we don't regulate our dietary supplements or our vitamin mineral tablets the same way your pharmaceutical or your prescription medications are regulated. So they can put what they like really into these. And that's what's scary. And that's why I'm going to say it's a very topical area and I don't have all the answers, I'll say from the outset. We will slowly get there, but not a lot of research is done in this specific area because they don't need to do the research. They can sell their supplements without having to do the research. Again, these are focus groups that we ran with ladies earlier this year, and women are taking these supplements. Cancer survivors are taking them, and they're not telling their doctors, and they're not telling their healthcare professionals. And so that's something that we're going to try and work on. I use this slide a lot. It's all about supplements. Supplements can work, and I'm an advocate for certain supplements in certain circumstances, and they can work for certain women. They don't work for every woman, and it depends what you're taking a supplement for. So I will always advocate for vitamin D, because we can't get enough vitamin D in our diet. I know that for a fact. So we do need a supplement. So there's one supplement I definitely think can complement what you're already eating. But do you need ashwagandha? Do you need black cohosh? These are the topics that we need to discuss. I'm all about taking a supplement as long as it's safe, as much as we can find out about it, but it can complement what you're already eating. Go food first approach, there's less risk. The minute you start to introduce loads and different herbal vitamin or compounds, botanical compounds, that's where we have a safety concern because we don't know what's in them. So what's the purpose of them? Well, the purpose of the supplements are out there that are targeted towards menopausal women is mainly for symptom control. And the reason I know this is because when I start to look at them, they don't contain enough calcium or vitamin D for your needs, so they're not really looking after your vitamin and mineral needs. They're targeting symptoms. And they're not regulated, and they can be taken without medical supervision, and they don't need to work, they don't need to state their full source of ingredients. So if you have multiple different preparations of ashwagandha, I cannot tell you from reading the packet where they've sourced that from, where it's come from, has it gone through any sort of stringent manufacturing procedures? I don't know. I will happily say to all patients not to take this one, black cohosh, which a lot of people would take for hot flushes. There is guidance, I'm pretty sure it's the BMS, and I'm going to go and double check that because I am having a brain foggy fart moment right now. I can't remember which document it is in, but I can safely say that this is one that you just don't need. I'll find you an alternative. You don't need black cohosh because there is some evidence, and again, it's hypothesized that it can interfere with tamoxifen. Any sort of hypothesis, any sort of suggestion, in my mind, is enough to say no until we find more evidence, because there are alternatives, and it's not something that's essential. We'll find you something else that you can take. The same with maca root, and there's actually one that Brenda had mentioned to me before, and it was after our conversation that I actually located this relatively new study, and it's only one study, and it's been done in Brazil, and it's in the lab. And they've done this in the lab on triple-negative breast cancer tumours. And they've actually found that consuming maca possibly and potentially might actually be dangerous for women with triple-negative breast cancer tumours. Now, I never, ever base my dietary advice on one study, let alone one little tiny lab-based study. However, when it comes to supplements and something like this, when there's absolutely no need to take it, then I'll find you an alternative. The fact that it's even showing any sort of potential effect on cells, particular breast cancer cells, I would err on the side of caution with this until we find out more evidence. So other things, just the final few slides, the risk quantity. You can take too much of something. You can. And when you go home, if you are taking any supplements, I'd highly advise you to pull them all out and actually count up how many you're taking over the course of a day. And then to check the labels. I would advise you to start reading the labels to see what's actually in them. Because without you knowing, you might be taking multiple versions of the same vitamin or mineral. So there might be zinc in a lot of your supplements that you're not aware of. You can take too much of any mineral. So it's really important to keep an eye on that. So don't exceed the recommended dose. The other problem with taking too much of any one vitamin or mineral, it can interact or prevent the absorption of other vitamins and other minerals that you're taking. So that's really important. Don't take too much of anything, unless you've been advised to by a doctor, and they might tell you to take extra vitamin D, but only when they have advised you to do so should you take extra vitamin D. I would highly advise you don't go over the upper limit for vitamin D either, because I know a lot of women probably do. So that would be the other thing. And the quality, especially if you're buying things off the internet from America, standards differ, and we can't stand behind them and say we know exactly what's in them. As I've mentioned, they're not regulated like medicines, and the labels provide no guarantee that the product contents are actually there. And I'm going to show you a nice example. This is Menomin. Again, I have no affiliation to any particular brand. This is their new label. Oh my God, I just turned it off, sorry. See this one here in the middle? This is the new label. Over here on the right is the old label. So this new label, I can't see isoflavones or soy anywhere in that label. Can you? I can see krill oil, phospholipids, omega-3, EPA, DHA. I've all the lovely vitamin D, B vitamins. I cannot see soy. And that's on the nutritional information. If you go to the ingredients, and on the list of ingredients is soy, but it's not in the nutritional information. So this is a problem for me because I don't know the concentration. I went back to their old packets, and they did have it on their old packets, and there was at least 200 milligrams of isoflavones within two capsules. So that is why we need to start looking at what we're taking. And there is a lot of promotion around these brands in particular. They're promoted heavily in our pharmacies. Do you really need it? I would say out of this, no, because if I was your dietitian, I'd happily get you a separate omega-3 fatty acid supplement by itself, cheaper as well. I would get you vitamin D, because even within this preparation, if you take 2 capsules of this product, you're not getting enough vitamin D. It gives you 10 micrograms of vitamin D. That's fine for the general population. For you need more. So taking this isn't going to reach your vitamin D requirements. And other than that, it has some added B vitamins. You can get them from a Centrum. You don't need to be taking this preparation. So it's getting a bit more knowledgeable around what's in them. Like, what are you actually taking it for? This is Menopause. These are, at least these, they actually say they have soy, where is it, the soy isoflavone. It's only 20 milligrams, so at least it's not as high. But yet I don't know where it's coming from. I don't know what's in it. So that's why I'd stay away from this one too. Purely because everything else that's on that list, I can get you to take that in a Centrum. And again, Centrum's my go-to because it's what I used in the hospitals. Katie, do you use Centrum?
Yeah.
Pharmaton?
Yeah, whatever
Yeah.
sort of a boots brand, a boots multivitamin.
But exactly.
Whatever it is, yeah.
A lot cheaper as well. And because a lot of these supplements cost between 20 to 60 euros per month just for one box, which I think is crazy. This is Menoactive, highly, highly advertised. Has ashwagandha, soya beans, and sage all added in. And it also has green tea. And because of these reasons, I would recommend this wouldn't be one that you would turn to for your menopausal symptom relief. And I think it was on this slide. Oh, sorry, I never highlighted it on the Menomin. I went onto their website and actually looked to see, can you take it with tamoxifen? So they have a little disclaimer saying that if you are on tamoxifen, discuss it with your healthcare professional. And then you'll discuss it with your healthcare professional and I'll say, I don't really know. So it's not very helpful. But I'm going to tell you now, just don't take it. I'm making that my rule myself. This is Menoactive, sorry. As I've said, it also contains fish oils. It contains B vitamins. But there's nothing fantastic that's in this that you can't get from other sources and that you won't get from a diet. And no one really wants to hear that because it's much easier to take a supplement. So it's just that you start looking and pinpointing certain things on the list. And this, the last one, I actually spoke with the lady the CEO of this company, because I wanted to find out where is she sourcing her lion's mane from, and how do you come up with the dose? These are questions that we don't really know the answer to, and I don't know how beneficial it will be to your symptom relief. But there's very little research done in lion's mane. So lion's mane comes from mushrooms. It is not estrogenic, but I don't know, does it interact with medications? I just don't know. I am reassured, I was told it doesn't, but we don't have studies to back it up. So look, this one has higher vitamin D, which I will say is a good thing. But other than that, it has B12, B6, K2, chromium. Again, you can get these all in another vitamin tablet if you want an option where you're not even doubting yourself and you don't have to worry about it. So how to choose one? Try and buy one from a reputable source at least. Check the labels. If you even have today, just start to look to see what's in the supplements. If you're trying to get vitamin D, if you're picking one out yourself over the counter, 20 micrograms per day. Okay, so if you're being prescribed it by your GP, then you don't need to be getting vitamin D in another tablet. You just take one source of vitamin D, no extra. Avoid supplements that have soy isoflavones added into them, maca root, black cohosh, and red clover, because red clover acts very similar, in a similar fashion to black cohosh. Caution with ashwagandha. There has been suggested potential interactions with Valium and Xanax. Now, ashwagandha I haven't seen actually being estrogenic in its profile for the way it works in the body. But it's just the fact that it can interact with other medications that women are probably on. Do we need to take it? This is one of the final slides, precautions when taking tamoxifen, any supplements that might potentially, and I say potentially because we don't really know. So this is caution. We're being super safe here. We're going to do our best to try and give you a list that's safe yet it's not too restrictive. That's what myself and Katie are working on at the moment. These are safer swaps, and my swaps are not fancy swaps. It's basically the Mediterranean diet, if you wanted to break it down. So instead of black cohosh, what people would take that for is for night sweats. Instead of that, you could introduce soy foods into your diet, vitamin D, magnesium. Ashwagandha, people take this for cognitive function, for irritability, for mood. Instead of that, you should try and make sure you've got omega-3 fatty acids. That can benefit and have an anti-inflammatory effect. And then instead of your Menopause, your Menomin, Mediterranean diet and vitamin D, they would be my go-tos for helping with overall health. And that was our research we've just done recently in Cork. But out of all these supplements that we've seen here, there's only 2% of the over-the-counter supplements contain enough calcium for menopausal women, and only 12% contain enough vitamin D. So you're better off getting a better quality vitamin D supplement by itself, and you're better off getting a better quality omega-3 fatty acid, and sticking to those. And everyone always asks, what do you take? I take vitamin D. I got it prescribed, high dose. I consider 20-25 micrograms high dose. And I also take omega-3 fatty acids. They're the two I would stick to. That's a summary of the advice. Calcium, vitamin D, oily fish, more fruit, more veg, move more. Everything you can add into what you're already having. I don't restrict. And you'll notice I don't talk about weight. Weight will come when you get your heart, your bones, your muscle under control. They're the things that are going to keep you alive. Focus on your nutrients, not on your calories. It's all about the quality of the foods you're having. It's not, and this is lovely because it complements exactly what Brenda was saying. It's not about one big change. It's not all or nothing. Just even today, if you decide you're going to walk around with your phone instead of sitting down, there you go. You've already accomplished a massive, massive win. So well done. I'm going to ask for all your help. Last 2 slides. We're going to be sending out a survey in January, finding out what supplements women are taking. It's all anonymous. It's going to be online. And we'll have hard copies for women who aren't on, who don't have access to internet. It's all around what supplements you're taking, why you're taking them, how much you're taking, where'd you get your advice from. We need to know what we don't know, and we don't know anything about supplements. So we're going to start building up the research around this topic. And in addition, Katie Johnston, down the back of the room, brilliant dietitian, currently working on a resource, a free evidence-based resource. It's going to be endorsed by the Irish Cancer Society, but it's all around this topic. Food after cancer for menopause. We'll be incorporating lots of advice around supplements in that resource. And that's hopefully coming out early next year. We keep changing our dates. So massive thanks to Katie Johnston, also Katie Nafida, who worked on the supplement research with me, and the LISA research group, who basically have driven this whole topic. So thank you so much. And we'll be sending out that survey through social media, but through ARC, through everywhere. Yeah, just keep an eye on it, and please complete it if you see it. Thank you.